Welcome to the Unlock Wellness podcast. I'm Dr. Casey, and today's guest is Dr. Krystal Barnett. And Dr. Krystal owns a family wellness practice called Extraordinary Health and Wellness and is located in Frisco, Texas. And I've known Dr. Krystal for a little while now. We've gone to the same trainings for years, I think, but she's such an amazing doctor and genuinely cares about her patients. She's so full of love and has an extremely powerful story. So it's really impossible for her not to make an impact on the lives of others. So thank you so much, Dr. Krystal, for joining me. I'm really excited to have you.
I am excited to be here to pour into the community. And, it's just amazing when we get to just save lives every single day. And I just want every person to know about health and healing. So
absolutely. But yeah, so why don't you start with your backstory a little bit, where you're from, how you got into chiropractic. That way people get to know you a little bit more.
Yeah, I'm actually from Baton Rouge, Louisiana, so definitely a Cajun baby. um, and I went to, so when I was in undergrad, I'm a very spiritual person as well. And, I started to feel very unfulfilled. I saw a lot of my friends going to law school, going to different schools, and I just, finished my undergrad in biology. And I was like, God, what else is there for me? And I remember being on my knees, so discouraged. And I was praying to God. I was like, God, I just want to do your will. I just want to help people, God. I just want to lay hands on people and just, see your miracles. I don't even know what it is. I just feel so unfulfilled. And that is when I actually got a call, and it was the dean of the Sherman Chiropractic School.
Wow.
And a while back, yeah. So I literally got my calling in that moment. If you can imagine being on your knees crying and just like, and you answer the phone, you're like, really? Is this really happening? And he's like, we've been thinking about you. You're accepted into our program, and we would really like you to come out. And in my biology class, the dean of Sherman, the dean actually came to speak to our class and talked about chiropractic and talked about healing. But, I just didn't think that it was, a popular profession, or I just didn't know, I think of just like a lot of people, like back and neck pain and pain management. I had no clue about literally how it would be so impactful for my life. So, I went on and I applied, and I just didn't think more about it. And when he called, and right in the middle of that prayer, it was just so fundamental for me. Like, this is exactly what I'm supposed to be doing. And so, I didn't end up going to the Sherman School. I ended up going to the Dallas Parker School, and it was life-changing. So that's how I got into chiropractic.
That's amazing. No, that's really cool. I love how they reached out to your undergrad too, because we had a lot of people come out and speak to us from different professions in undergrad, but we never had anybody come from a chiropractic school, and I think that would make a huge difference for people to hear it. I mean, that side of it, and like you said as well, like not just hearing about the neck pain and the back pain and the car accidents, which is pretty cliche chiropractor, but all of the amazing healing properties that come along with that as well.
Yes, absolutely. And that's so important for me. Nothing cringes me more when somebody say, oh, you're a chiropractor, neck and back pain. I have this injury. I'm like, yes, we can help you with that. But did you know that the first person was deaf for 18 years and got their hearing back? Right. It is way more than pain. That person wasn't in pain. And we have to make sure that we're practicing the way it was intended. I mean, if you actually look online, that hospital is still on video, that there was a whole hospital that was big as an airport where people would go from miles around and were helped with multiple sclerosis and all type of debilitating diseases. And it really should have been called Last Chance, because they had been to the medical doctors, they'd been all around, and they had this hospital that literally people went there and they were there for months and literally got their whole life back, children and everything. And there's children with polio and all these different things. And I'm like, why aren't we practicing that way? Why don't more chiropractors, or why doesn't America know about this? And so that's why I'm so passionate about preventing the sickness and disease from happening and getting people on a plan to make sure that they're managing their subluxations instead of managing their symptoms.
Absolutely. And what led you, did you go into chiropractic school knowing you wanted to be more on the holistic side of things? Or did you go in for, you just, were interested in the profession and then it led to that?
I was interested in the profession, and I thought that I can make a difference. And I like the fact is I always hated medicine. Even if it was like, an antibiotic, I'm like, why do I have to take this, Mom? Like,
Right.
no. And so, I just knew that, it talked about that the body does heal itself without medicine, and that really was my main focus on why I decided to go to school. So fell in love with the campus. And what really changed my life was I remember Gilles LaMarche in Parker Assembly. His assemblies, I think it was like maybe the first 2-3 weeks of school. And he was actually talking about his son. And Gilles LaMarche, he was one of the administrators at the school. And he's talking about his son and his son's experience, how his son was outside playing with a firecracker and the firecracker blew up in his face.
Wow.
And he said, you can hear your children's cries, but when it's a cry that is actually something that is terribly wrong. And he went to his son and his face, you see the skin coming off and he is panicking and, takes his son to the ER and his son is like, Dad, why aren't you adjusting me? And so in that he had to have, a reality check. Oh, yes, I should be adjusting my son because they literally said that, there were, I think, 2nd-degree burns and they were going to start with surgery the next morning. And so he's like, Daddy, you normally adjust me. Why aren't you adjusting me? And he adjusted his son every 5 minutes throughout the night. And when he went to prepare for surgery the next day, his skin had healed and they canceled the surgery.
Wow.
And so that story and his big why was so impactful. And also being in the same, being in the same class with Jason LaMarche, which was his son who had the firecracker. And I'm looking at him and he looks beautiful. And I'm like, oh my gosh, this is crazy. So I'm seeing his son in real life now in chiropractic school and he's telling the story. And I was like, I need to know how to get that.
Right.
And I need to make sure that I am practicing like that. Where do we learn how to do that? And so that's when I went on my mission to make sure that if they were not talking about miracles and healing, I didn't want to listen.
Right. No, absolutely. And I mean, I think, we both experienced in chiropractic school, you obviously have to learn a certain amount of information and it's just part of it, but it's hard to stay focused on some of that sometimes when you have seen scenarios like that, or you've heard stories of amazing healing that's happened just from, helping restore the nervous system to its highest potential. So it is hard to focus as a student when you know that type of situation is possible.
Yeah. And when I'm to focus as a student, yes, there's one thing about learning the information and I turn my ear off to nothing teachers were saying.
Right.
Because I get to pass boards and, Parker is one
you
of
have
the
to
most
get past boards.
amazing
Yeah.
programs that we had and passing boards and everything. But it's just the self-talk or the talk of people saying that what's not possible.
Yeah.
And, so any person that was telling me what was not possible, such as students or their different philosophies, I turned my ear away from that. And I went to everyone that was saying what is possible.
Right.
So if a clinic was saying that, going to see outside doctors, oh, no, we don't do that. Well, I went to the clinics where they actually do that. And I spoke with the patients and I sat in their offices and I spoke with patient after patient after patient and got their personal stories to the point that I was so impacted that I was telling the doctor, okay, look, what do I need to do to learn how to communicate this message? And also learn everything I need to know to have confidence behind it so that I can have these type of reproducible results so that I can make sure I have the certainty and the knowledge when I'm showing my patients how their body heals.
Yeah, that's amazing. And, I know with you personally, Dr. Krystal, you do have an extremely powerful story that has helped you impact so many lives within your own community. And I'm sure beyond your community. But, if you wanted to share some of your story with your sister, I think it would really make a huge impact on, everybody that's listening.
Yeah, I would love to share my my story with my sister. But even before my sister, I've had patients that have had asthma attacks and that I've adjusted them and they healed. I've had patients whose stage 3 cancer, my office manager, stage 3 cancer, not that I treat any of those things. And within a matter of 3 to 4 months, she went back to the oncologist, did no chemotherapy, no radiation. and it healed. So those things prepared me for, really started to move my philosophy into another realm when I started to see these things. But the most impactful story is my sister. And just imagine growing up with someone who's always healthy, never had any health problems, fit, prom queen, worked out every single day, ate well. And she is working on her master's because she was going to med school, and ended up going into the hospital because she started having hives. And hives and diarrhea to the point that she couldn't keep her fluids. And although she doesn't like medication, she's one to take it if you are in a tough situation. So she ends up going into the hospital, and they say, okay, we're going to give you fluids, and we're going to give you a cortisone pill for your hives. So they give her the cortisone pill, and that cortisone pill causes a seizure, and she cannot speak or recognize her family. Then the doctors are not wondering what caused the seizure. They actually started pumping her with more medication. They're not realizing that what caused a seizure was the medication, that they started to pump her body with fluid to the point that her body, she normally weighs 125 pounds. She weighed 200 pounds within a few hours.
That's insane.
And they pumped her. It's insane.
Yeah.
And they pumped her body with so much fluid that her skin started to burst open. Her vagina burst open and fluid started leaking out. They did a bone marrow tap. They took her spinal cord fluid was leaking out, because they gave her this cortisone pill. So I get the phone call that my sister's in the hospital, and I come to Louisiana and I see her. I don't recognize her.
She couldn't be recognizable at all.
Yeah, she's unrecognizable. And I pull back the sheets and I'm looking, and I see that her toes and her legs are turning black.
Wow.
And that's when I told the doctors and the nurse, I said, this is gangrene. This is terrible. They have compression pads across her legs. And the compression pads are so tight that they have cut the blood supply off to her legs. And I ripped those compression pads off, and I start adjusting my sister right there. And I feel that she doesn't have any pulse in her legs. And I'm adjusting her body, and the pulse starts to come back. But then the doctors told me that, look, this is what, you can't do this in here. You have to go. My mom told me to listen to the doctors. And so I left. And that's when they amputated both of my sister's legs.
Oh, my goodness.
So now she's a double amputee. They cut one longer than the other, and the leg is not healing. So the fluid starts to build back up into her heart, and she gets congestive heart failure. Now she's on bags and medication, end up back in the hospital to give her another steroid while I'm there. And she has another seizure from the steroid. And I adjusted her out of the seizure. And it's crazy that I see my sister dwindling away right in front of me. And I was like, if you keep taking these drugs that your body is so sensitive to, I don't know if you're going to be here.
Right. Especially since it's crazy because it's like she was so sensitive to that first 1 inch. That should be like the immediate red flag,
Right.
Yeah.
But that's the definition of insanity. You trust a medical system and you keep taking it, even though there's the symptoms, even though it's more medication, even more it's more drugs. It's like you're brainwashed that this is still going to be right for me. And that's what was happening to her. And this is the system that she's been taught, the system that she's been she's trusting in, and it's the system that my mom is trusting in. She has the same, it's a year later, and she's trying to heal so she can wear prosthesis, and her body won't heal. And I'm like, look, you have damage to your nerve system. You have pressure on her nerve. She's having the same stomach ache that brought her into the hospital in the first place. We need to get that pressure off the nerves to your organs, and you need to get here now. And she said, I'm going to come. But she didn't. She ended up going back into the hospital, and she went back in the hospital to take more tests. And so sometimes you just want the test, but sometimes the test is what will be the problem that would take the person out. But in her case, they could not find anything, and they were discharging her. And as they were discharging her, the nurse came back in and gave her something for the pain. And it was one pill, 0.5 milligrams of Dilaudid, which is a pain pill. And when my mom walked back in the room, she saw my sister gasping for air.
Wow. Was it another seizure?
Yes. And they said she would be fine. And they worked on her for 15 minutes. And that's when she passed away.
That's crazy. How old was she when that
29.
happened? 29. Yeah, that's crazy. That's crazy. And I know that was not too long ago, was it? Was it?
It was in 2014. So
Okay, yeah. That's just so crazy. And, I'm extremely sorry you experienced that. And I do know that having that type of experience has taken you to a whole nother level of being a doctor, because you know how you can help people, though. It's just so crazy to have to hear those kind of stories.
and it happens time and time again.
Yeah.
My aunt just yesterday, chemotherapy was form of World War II warfare, and the mustard gas, and this is what they're using people with. This is what they're using to help people, but they don't realize that, while the people were dying, while people were using this mustard warfare, they saw that the tumors were shrinking, but those same people died. And although the tumors were leaving, the death was the end result. And so sometimes, with cancer, the patient will die and they would still say that that's a success for chemotherapy. The cancer went away.
Right.
And my aunt just yesterday passed away because the chemotherapy ate up her esophagus and stomach, and she couldn't eat or drink, and she passed away.
Wow.
Happened to another one of my patient's family members. Their esophagus and stomach were eaten away. They could not eat, and they passed away from the chemotherapy. And it happened to another patient, the same thing.
That's crazy.
You just think about, how could this just be the way for health?
Right.
Because the first thing is do no harm. That's the first thing. And this is causing harm. And, I just think about sometimes when you're given for high blood pressure, you're given stomach. And my sister died of a stomach ache. They took her legs. They took her life. Some people say, well, you adjust too much, or if there is subluxation in the nervous system that's affecting the nervous system, and your nervous system is the master system of the body that controls health, healing, and functioning. And if that subluxation is there, you remove it, the body heals. If the subluxation comes back, there is still interference, you remove it and it heals. Mm-hmm. And so you think about that the medical doctor is able to give someone a drug for the rest of their life for blood pressure, headaches, all of these things. That means it will never fix them, and it's masking the symptoms, and it causes more and more drugs. Just think about if we're able to prescribe for the subluxation one adjustment every day for the rest of their life, what kind of disease would be left in the body? What type of healing would happen? What type of life would that person have?
Right.
And so, if you look at the comparison, some people will say getting adjusted every day, that would be crazy. But looks like with the medication, it's crazy, because you look at death by medicine, that iatrogenic deaths, medical mistakes and errors from physicians, from medication, is the number one cause of death in America. It is killing more people than heart disease, and it's killing more people than cancer. So we have to look at something different. And, as doctors, we have to scream this to the rooftops. And, people think that we're over the top, but I feel like we have to be over the top. That's over the top.
Right.
My sister's death was over the top. My aunt's death was over the top. It's an epidemic. People are dying. And we have to be the solution to help grab them out of a system that will never bring them health. Thank God we have it for crisis care.
Absolutely.
Thank God it's there for crisis, but we weren't supposed to be in a crisis for 5, 6, 10 years.
Yeah, absolutely. Absolutely. And no, I love how you put that, because crisis care, we have the best, but even on the, if you wanted to look at like a blood pressure medication, if you read the packet inside that blood pressure medication, it'll tell you don't take more than 2 weeks. And people are taking this for 5-10 years and been told to take them for the rest of their lives. Our bodies aren't made to process that for the rest of our lives. Our kidneys definitely weren't made to process that for the rest of our lives. The medication is there to stabilize you. But you have to figure out, well, why do I have high blood pressure? Am I getting adjusted? Am I putting the right foods in my body? Am I moving? It's not, I think, I'm sure you were at the seminar too, whenever, Dr. Majors the quote was a prescription is just a permission slip for you to continue living the exact same life. And that's right. And that's all it is it's, if you're taking the medication because you don't want to make a change, and really it should be take the medication to stabilize if you have to, but then make the changes so you don't have to take that for the rest of your life, and you can, find true health. Right.
And that is what it is, finding true health.
Yes.
And so do you want a prescription slip to keep living the same way? And that's what people are doing. And it doesn't have to be that way. There is a solution.
Yeah.
The best cardiologist is inside of you. The best kidney specialist is inside of you, the liver specialist. And we are the specialists that are trained to remove those interferences so that the power that made the body can work to heal the heart, to heal the lungs. Every 6 weeks we get a new liver. Every 6 months, a new heart. The body is made to self-heal and self-regenerate. Every year you get a new body. Every 7 years you get new bones. Now, why aren't we healing? Because you're not hooked up to the source. You can ask for power all you want, but if you don't charge your cell phone, you're going to have just a dead phone. And that's what's
Absolutely.
happening. You got to get charged up. You got to turn the switch on. You got to turn light. And, subluxation means that your absence of light, absence of the light, absence of the healing that's designed to flow to keep us move in the right direction. And so, that is what people need to get. That is something that you need to do to create generational health. I just looked at a research article yesterday that the telomeres are responsible for aging in the body. And as we get older, they shorten, and that's what causes the aging process. But with the adjustments, that the newest science shows that the telomeres actually, when you get adjusted, they increase in length, which means that you're reversing the aging process. That you're stopping the aging process. It's actually changing strands of your DNA. How great is that? That's scientific proof. New research that just came out.
I saw that. I haven't read it yet, but it looks awesome.
Yes.
Yeah.
Yeah, that's what we get to do by turning that switch on, so that can work at 100%. Interleukin-2 is released into the spine, and cancer patients pay $2,000 a shot for that. That's increased with every adjustment. The natural T killer cells with University of Cambridge actually showed that when the T killer cells goes and surrounds and seeks out and finds those cancer cells and wraps around it, and literally it disappears. That is increased with every adjustment to increase the T killer cells that are naturally in your body to kill cancer. And that's what we get to do. What happens with an adjustment? I'm just so grateful that you're doing podcasts, you're doing things, you're on the mission with me to help save more lives, so that people can have an opportunity to kiss their grandkids. So people can have an opportunity to, walk down the aisle with their spouse instead of going in a wheelchair with their spouse, or changing their spouse's dirty diapers.
And Dr. Krystal, I love all of the education that you give your patients, and I follow you on social media and keep up with your office, and I think what I love the most about you is just the amount of hope that you give them, and it doesn't matter what any patient is dealing with. You give them the hope that their bodies can heal, and if they are doing the right things, if they're getting adjusted, if they're doing the right things nutritionally, if they're moving, if they're just doing all of the things that they were intended to, that their bodies have the capabilities to heal. And I think we don't get enough hope from other sources like we should. And we both know that. I mean, every other commercial is a drug commercial. Every other commercial is telling us that there's something wrong, that we need a pill, that we're too tired, or you know what I mean? So it's just having a physician, like yourself, that is feeding hope and feeding love into them. It's really amazing. And I'm super appreciative that you are in your community and just pouring into them.
Yeah. And, the thing is that the hope is there, but the principle works 100% of the time.
Yeah.
And, the question I always ask my patients, what system controls all healing in the body? And they'll tell me the brain and nervous system. Is your body with pressure on the nerves or off the nerve? Is your body going to heal better with pressure on the nerves or off the nerves to your organs? Off the nerves. And how long do you want the pressure off your nerves to make sure that your brain is able to get the proper signals down the spinal cord, over the nerves to the organs, so that you can be healthy and for the rest of your life? And that's what happens with every adjustment. So whether we look at a symptom or not, whether we talk about what can happen when you give the person the hope, the principle is the same. That when we move that interference, their body is going to be at its best chance to heal, to repair. And that's why we have to see the babies. That's why we see the families that will never end up. And where we've had for not getting adjusted for all those years where disease had a chance to build up, that we can create generations of healing and legacies. And so that's why I'm so grateful to be on a team with you, to save lives, to have someone to talk to and, understand what we do every day and see those same changes and miracles.
I love it. And Dr. Krystal, what is the best way for people to follow you on social media? That way they can keep with all of the great information that you're putting out there in education?
Yes. Most people follow me on Facebook, and it's Krystal Barnett. It's just Krystal Barnett, our Extraordinary Health and Wellness Center. We haven't been posting a lot on there, but going forward on the office website, Extraordinary Health and Wellness Center, not the website, the Facebook, you'll be able to find a lot of information on there.
Perfect. And then Dr. Krystal, just one closing question that I ask everybody. If you could give the audience just one piece of advice, maybe it was something that helped you, but if you could only just give just one piece of advice, what would it be?
One piece of advice would be that you don't know what you don't know. So you don't know if there's disease in your body. You don't know what's happening to your body. But if you can just make sure that you clear your nervous system for the rest of your life, that you're going to be at the best health possible and God's power can flow. So it's to just tell your family, tell everyone you know what you don't know. Get to a health center, get your nervous system checked so that we can move you in the right direction.
Awesome. I love it. Thank you so much, Dr. Krystal, for coming on. I loved having you.
Love being here anytime.